By the people, for the people, the gathering to get health care now. Chapter 25, Administration of the IPA. An IPA having less than 100 primary care physicians and 30,000 patient members requires about 20 employees to manage its contracts and provider relations. It takes about 5 employees to start the IPA, contract with physicians, and complete the credentialing. You will then need an added employee for every 750 patients assigned to the IPA through its contracts with health plans. An IPA of this size will likely have 5 teams of PCPs and specialists, and each team will have a quality assurance committee and a medical director. And 5 of the employees will be administrative coordinators for these teams. 10 of the employees will be assigned to the PCP offices and their assigned patient populations as care coordination specialists. That leaves you with a CEO, accountant, 2 credentialing specialists, and a secretary, the beginning staff. The administration is not there to guard an office, answer the phone, and pass the buck to the health plan or back to the physician, though it would be very easy to fall in such a trap. It's a field organization that is in constant contact with physician offices and with patient members. It's all about relationships and having your ears to the ground about the medical needs of the patients and the support requirements of the physicians in teams of facilities and patient outcomes, in terms of facilities and patient outcomes. The logical problem of this kind of administration is the continuous contact with patients and the physician offices. 20 people cannot see 30,000 people very often, but 100 physicians plus 20 consultants plus 20 nurses can see 30,000 people several times a year. When everyone is in the game, then the contacts have great benefits in terms of outcomes. Simple things like having the correct contact information for each member and each physician and each of their staff can be maintained through this continuous activity. The way you know it's not happening in the present systems is from the massive numbers of errors in their databases, both online and in printed directories. You cannot appreciate this until you're trying to call patients who have reported problems who you're trying to make a referral to, a consultant, or you're depending on information from published directories. In the last week, our nurses were given the names of 150 patients who had to be seen for problems within 60 days. They were unable to contact because of bad numbers and addresses about 30% of those people. The nurses corrected most of the bad information, but not all of it. They made the system better, but not perfect. They relieved some suffering, but not all. Had this continuous contact not been done, then the owners of the data would have been trapped in the delusion of their world, not as it is. These are simple things, but errors are found in complicated things, in medical records, in family support systems, in the environment in which people live. If you become just another bean counter, a paper shuffler, and a phone call forwarding agency, you have missed the whole point of IPA administration. You are either dynamic or you're dead. If you need incentives other than the job itself, ordinary wages, benefits, and mutual support to do this administration, then you have the same problem as in the selection of medical teams. If the administration seems more powerful and more aggrandizing than the medical team of the health plan, then it will all become a competition instead of a service. The goal is still the relief of suffering through the health maintenance of the members. Agencies that find people jobs in which they are placed based on the usual compensation for the skill category the applicant represents sounds perfectly reasonable, but often these placements just transfer whatever's wrong in the whole community to your company. Considerations for jobs should be based on need, circumstances, and compensation of the whole administrative team. The material maintenance of the team members should not be on their minds in the relationship to this job. There should be such a commitment to what is being done for others that mentioning job offers from anyone else would seem shameful. The company attends to the health of its members, patients, physicians, and staff. This includes physical, mental, and financial.